One thing that I've been using a lot of, especially in the lower extremity, are movement breakdowns, which Butler talks about a little bit, but this is kind of a newer concept that I learned when I took mobilization of the nervous system with Adrian Lowe. I've just kind of modified it a little bit, and from my personal experience, which isn't, for whatever that's worth, I've seen it to be more effective, at least in lowers, over sliders and tensioners. So I'm going to show you just kind of one that I made up. And it's going to involve the slumped position. Basically, what you're going to do is you're going to take whatever neurodynamic test is positive and perform each individual motion of that for desired amount of reps. I usually have my patients do 10 to 20. So I'll show you the slump one. I'm going to hop up on my ledge. Hopefully I do not hurt myself and end up as a funny YouTube video. So I'm going to get in the slump position, chin to chest, trunk flexion. The first movement I'm going to do is hip flexion. So I'll do this for 10, 20 reps. You can also take one of your hands and use a little bit of, just so you can get to the end range. So I do that first. Then I do hip flexion and horizontal adduction. So I'm aiming my knee to the contralateral shoulder. So I'm going to go up like that for 10 to 20 reps. Okay. Next thing I do is I tell my patients foot shakes or just internal, external rotation. So back and forth like this for desired number of reps. Then I'm going to do a tensioner, so knee extension. You can try dorsiflexing the ankle, plantar flexing, depending on what you want to make more or less aggressive. So I do this for 10 reps, 10 to 20 reps. And then last but not least, do some ankle bumps. Now you don't have to be out in the extended position like I am. I usually don't have them do that. Okay? And then reassess, see if you made a difference.